The lives that they're leading before they walk through our doors are tumultuous, they're vulnerable, they're chaotic. Our clients have had historically pretty negative experiences with healthcare and are reluctant to share their vulnerabilities with us, understandably so. And so just having an understanding or an appreciation for the fact that it's not really about us, and we have no idea what's precipitated them coming to see us, and that them coming to see us in and of itself is the greatest compliment that we can receive, because it means they trust us enough to give us a try.
The opioid crisis has led to over 35,000 recorded opioid overdoses and 8,000 deaths in Ontario alone since 2015. It is an epidemic public health issue in Canada. Stigma contributes to the opioid crisis. Stigma looks like using language that puts blame on patients or attributing all patient health issues to their substance use. Stigma can be internalized or enacted. Research has shown that people who use substances and experience enacted stigma, i.e. stigma from others, have increased odds of experiencing an overdose or death. Why is this? Well, when people experience stigma in a healthcare setting, visits can be uncomfortable at best, even traumatic. And when people don't feel safe or comfortable accessing healthcare, they are less likely to seek out medical care when they or someone they know is having an overdose. Many nurses report that they don't feel they've received enough training in mental health or substance use to support patients who use substances. What can we do to minimize the negative effects of stigma? As a healthcare provider, shifting your perspective can improve health outcomes for patients who use substances. Connecting with the patient helps build trust and therefore increases compliance to a care plan. Ask the patient what their health priority is. Don't assume that the health issue is related to substance use or drug seeking. Avoid stigmatizing language like drug abuser or addict. 2/3 of people who use substances have experienced some kind of trauma or abuse. So allowing the patient to maintain autonomy in the appointment is vital. Instead of announcing the care plan, try suggesting care options and ask if a patient is interested in them. Building connection with patients who use substances will allow them to feel comfortable returning for follow-up care.
In my experience, the nurses and the doctors tend to forget that each time that I'm in that situation, it's terrifying. I become acutely aware of the fact that I might smell funny, that I might not look very presentable, that I might that I might miss the mark on what is socially acceptable in that moment. And just because I've been using for a long period of time, or because I've, because I'm a frequent visitor of the emergency department, does not mean that I'm not really acutely aware of those things, does not mean that I'm not affected and embarrassed. I think sometimes some of the easiest ways to get people to open up, and certainly works with me, is when you can admit to me that you're not sure exactly what's going on with me, and then help me flush it out.
Nurses play a life-saving role in the lives of people who use substances. You can find support and more information about these impacts at wgdrugstrategy.ca/support-not-stigma.